announced, as I said, that the job cuts would be happening, and then they're happening across the board. The first one was in Emerald. So in Emerald they cut all of the community health nurse positions, people who are doing outreach palliative care, immunisation, deadly ears, all of those sorts of really primary and preventative programs are just so important, and Indigenous focus as well was particularly badly hit. And with things like this, it won't show for a long time. So they're saying Medicare Local should pick this up. There's no Medicare Local in Emerald. The GP's not going to pick it up. Yeah. It's just not going to get done. Every week we put out a cuts update. And so, and then we send that out to the media as well. For example, last week we had 40 positions go at Prince Charles. The week before, there were 230 positions go at Cairns Hospital and Health Service. And the impact on primary and preventative community health services has been the most significant. That's where it's really being cut. It's really the community are extremely concerned.
Give me a kind of feel about how the nurses have responded to all this.
I've got to say, at first they have been shell-shocked, but it's turning. The mood is turning, and they're getting angry, and so that will mean there'll be more action. Absolutely on the way. And I think that our members in the private sector certainly realise that they're so reliant on having a strong public sector. Their interests are served, in terms of the outcomes that we've been able to get for private hospitals, for example, and matching or near matching public sector pay, is because we had a strong public sector.
Hey, look, tell me what the community reaction is to all this as well.
Community reaction has been fantastic in terms of our big campaigns we've had about state government nursing homes, and the response is, well, we can't believe this is happening too. This is the most outrageous thing, and people say, I'm not a Labor voter, but I cannot believe what's happening. So we're very active in the media. We get the message out there. We're always available to the media. And that pays off. It's a lot of work to bend over backwards to meet their needs, but that's what we do. Interestingly, some of the community people in some places are stronger than our members on the issue.
What do you think is the cautionary tale for New South Wales nurses out of what's happening up there?
I think that the lesson is that you have to be politically savvy. You have to be organised, and you've got to be organised with your community. We can't do this alone. This is about linking into the community and with other unions and like-minded organisations. But it is about really, in a way, toughening up a bit, I think, with the pressure on them. It is a bit like a battle, but the other thing is you've got to pace yourself. There's going to be a lot of battles, and this is a war, though, really. If we're going to stick to that, this is a long-term thing, and it could go on. The likelihood is they're going to be there for another term, But don't lose hope, because, we're a force to be reckoned with, nurses and midwives. I mean, the community do value and respect us. It's just that politicians don't, quite often. Well, these politicians don't. So that's where it gets into the community campaigning and linking in with the community and making sure our message is heard there, and using different avenues to do that. We've got to mess it up a bit, The old ways of doing things aren't going to cut it anymore in this environment. It's got to be some totally different strategies.
Yeah.
And fun ones too, as well.